How often do you visit a dentist? Or rather, I would ask, when did you last have your checkup with a dentist? Or you think it is all luxury? That is a wrong mindset that we want to improve today. And I want to thank you so much for choosing Church of Uganda Family TV. This is the Family Hour, empowering families one episode at a time. Family Hour is on from Monday to Friday. Monday is always education. Tuesday, we discuss health, family health, and that is exactly what we are discussing today. Wednesday is always family, finances, and wealth, while Thursday is always leadership and governance. And we close up the week with parenting on Friday with Claire Bwenje. Now, this is Tuesday, and as I highlighted before, we are discussing health. If you've watched us from the time this month started, from the very first Tuesday of this month, we have been looking at oral health. We've talked about a number of things concerning oral health. We talked about the the dental challenges among children, the dental challenges that affect the elderly. We've talked about quite a number of interventions. Now, this is our last episode of family health as we discuss oral health, and you do not have to miss this discussion. Edwin Austin Mukalazi is my name, and with us is the one Dr. Brian Rushaju, who is the director of RAN Foundation. Doctor, it's a pleasure having you once again.
It's a pleasure for me to be here.
Yeah, it has been an interesting session, 4 weeks session, and
That's right.
I really feel time can really run, but
right.
and we shall still get you again soon, because we realize dental health is really very, very important.
That's right.
Yeah, but kindly greet our viewers as we get into today's discussion.
Yes, good evening, viewers. I'm glad to be here once again. Thank you.
Okay, how is RAN Foundation? If
RAN
you can start it
Foundation,
from there.
RAN Foundation is fine. We are serving the people, as I mentioned. We have interventions in rural communities. Our setup is beyond Health Center 4, the catchment of Health Center 3, 2, and 1. So in the rural settings, we give urgent oral health care, but also have Gari Health Institute, which is an institute that is empowering young people with dental skills. Then we have dental clinics that meet the need here in Kampala, and we have a community children's clinic in Kasangati that looks at children needs specifically. And we are happy to be able to play this role in our communities in different areas. We partner with different organizations during their mission activities to extend urgent oral health care in communities as we share the love of Christ in using our skills in that regard.
Okay.
Yes.
This is very good, and we want to commend you for the good work done. Thank you so much. Now, today we are looking at something interesting. When we look at a dentist, or when you see a signpost, this and this dental clinic, what comes into someone's mind is removing our teeth. In Luganda, we commonly call you abakozi b'amannyo. Someone will not say omusawo w'amannyo, they will say omukozi w'amannyo, and which is a little funny. But today we are going to look at that and see why are you trained to only remove our teeth so that our jaws can look funny. We shall look into that later. But Doctor, just to have a recap of our previous discussions, especially for someone who is watching us for the first time, let us briefly go through some of the challenges, oral challenges that children face, and then we shall go to the elderly as we now draw closer to today's discussion.
Okay. Yes. Thank you so much. Our discussion has really been to look at the different challenges that affect us, and whether children or elderly or middle-aged, the biggest problem is tooth decay and then gum disease. These are the two major problems in the world that affect people. We said in Uganda, we're looking at about the recent survey has put us over to 90% of people struggling with oral health challenges.
Okay.
And so it's a big problem, and largely tooth decay. And we said tooth decay comes when you fail to remove food that you have eaten, the bacteria which is in the mouth, which is normal bacteria. This is bacteria that God made is supposed to be there. It's called normal flora. So this bacteria is supposed to be there. It has its role, and it's everywhere. In the whole body, we have that normal bacteria. But when you give it a lot of food, or especially fermented carbohydrates or refined sugars, then you cause the populations to increase. So when the populations increase, they begin to, of course, have byproducts.
Yes.
The same way when you take water, when you go to the restrooms, you don't pass out that water. It has changed.
Yes.
And if you see where men usually urinate on the road, you will appreciate that what we pass out is no longer water or soda that you took. And so this bacteria will also metabolize the sugars and produce lactic acid. And that acid burns your tooth. We can say burn, but ideally it demineralizes.
Okay.
It removes minerals from your tooth. So what happens is you remain with a hole, with a cavity, because if you remove bricks from a wall, the cement cannot hold on its own. So the cement that is in the tooth cannot hold without those calcium ions. So when the calcium ions are lost, what remains is the phosphate substances which cannot hold. So you have a cavity, you have a hole. When there's no intervention, then it goes deeper and affects the deeper parts of the tooth, mainly the pulp. And then you get what we call pulpitis, which is the inflammation of that pulp. And that is painful. That's very painful. That many people now, that's when they think of a dentist. And of course, then they can treat this tooth, can fill it, can do root canal, or you can extract it, especially if it's too bad and you're having pain, you're having maybe pus, maybe they remove it. Maybe not, because there are things that can be done to restore it. But we said those options may be very expensive, especially for the ordinary person to afford. But we equally have gum disease, which is a problem that is attributed to the same thing. When you don't clean and the bacteria, they start to grow. That population, what they form, what we said is plaque. And that plaque is a good habitat for them to begin to grow. Yeah. But in that, they will release chemicals that irritate the gums. Inflammatory, like an inflammatory, or what you can say, things that will attack your gums, and then your gums begin to swell. And you notice this when you bleed after brushing. So when you brush, you see blood is bleeding when you take sugar cane and those hard foods. Yes. And those are early indicators that tell you there is a problem, you need to go and solve it. Okay. But like we mentioned, many people in Africa really, they will try to make their own interventions, take painkiller, try to put things and some herbs in order to treat it. But whereas some may work and others may not, we've seen that people who delay to go and have intervention, have proper treatment, will eventually either lose their teeth. You've seen even those, the old ones, where they maybe don't have pain, yes, but the tissues around the tooth have been affected by this process, because from that bleeding, what we call gingivitis, it goes to periodontitis, which is now the inflammation of that whole supporting system of the tooth. So the fibers and the things that hold it, like the root system, can disintegrate, and then the tooth comes out on its own without even having pain. So old people quite often have this challenge, so the teeth will just fall out. And so it's important that at some point, before these things become worse, and they are hard to intervene, it is important to seek advice from a dentist. And I believe that a dentist can offer more than just an extraction. We are more than the toothers. We are more than abakuzi b'amanyi. I think there is a lot more that we can do and offer, and then which should be able to help people retain their teeth into old age, so that the teeth can perform their function. Okay, because our teeth are there to perform certain functions. Our teeth are important. Begin with, we always study from primary level science. We use them to chew food, by cutting food, and but generally we use them to eat, and there's no one who can dispute that. But why we say eating is important, because digestion of certain foods starts in the mouth. So when you eat carbohydrates, what we say energy-giving foods, so cassava, whatever, those are energy-giving foods, their digestion starts in the mouth. So you are likely to have a problem where a child is having pain, maybe they can't communicate. They put cassava one side, it pains, they throw it the other side. And because it is paining, they decide to swallow so they break the food into 1-2 it's paining, or they're having challenges, they swallow it. So they may miss these enzymes that work on that food. And then you find that they're not getting maximum benefit from the food they're eating. And so it's important that you properly chew your food and break it down, so that the saliva, the amylase, can work on the enzymes can work on this food, and eventually you get maximum benefit. But we use our teeth to smile as well. So if you don't have teeth, it's very difficult to smile. You have people who are not confident, want to smile and they want to touch their mouth, and so teeth, you'll never say Miss Uganda who has gaps. So you find that it's important that you have your perfect smile, because it brings that confidence to smile, confidence to speak in public, and also the beauty. Of course, I've talked about speaking. You cannot talk very well without teeth, because your tongue will touch the teeth in order to formulate certain letters. So it will be difficult for you to pronounce certain letters if you don't have teeth. If you close your mouth and try to pronounce some words, there's some words that you may not be able to. So if you're a teacher and somebody who is a public speaker and you don't have teeth, you'll struggle. Of course, people tell us that, I will just have a replacement. One time there was a teacher who had put artificial teeth. And as he began to speak, of course, the urge to sneeze came. And as he sneezed, the denture came out. And that was the end of the lecture. And so these alternatives may not be, there are things that you try to do, but maintaining your own teeth and maintaining the proper function is so important that you do not want to compromise it or replace it. And so they help us really to do quite a number of benefits that we have when we have these teeth. And so it should be up to you to really have an urge to keep them, to find out what should I do, what can I do. So that's why we said, even when you don't know the function or don't appreciate beyond maybe just eating, it's important that how do I prevent this problem? How do I make sure that I don't get tooth decay, I don't get gum disease, and many others, the rare ones, there are also many. But those are the main problems that when we open the mouth of people on a daily basis, for us we see on a daily basis. But you see, that's a common problem. So brushing your teeth 2 times a day is so important that you've got to make sure you disrupt that activity of bacteria. Don't leave the bacteria to colonize the place, and they take advantage and call their friends. They grow out of order, then they start attacking your teeth. Disorganize them, disrupt them, disrupt their meeting. Don't allow them to
to gather.
Yes. So as you brush, you're disrupting them. You're breaking the corona. You're disorganizing them. Just like the way we clean our rooms, anything you really don't attend to, whether it's your room, you never clean it. You never. Before you know it, there will be things which will invade you. So you've got to disrupt. But then when you use toothpaste, you are adding, you're putting more value in terms of reinforcing your tooth. You're putting medicine that reinforces the tooth. And so those are really some of the main things that we've come discussing that people need to know and should not miss when it comes to keeping good oral health.
Sure. There is another common concern, Doctor. Someone would say, why is it that sometimes when I have a toothache, my cheek swells, and then the other time it doesn't? What causes the swelling? Or why is it that for some people the cheek swells and for others it doesn't?
That's a good question. So when this process that I've been talking about, that the acid and this whole decay starts with because the tooth has different parts. So what we have studied in primary 4, we know that you have enamel, which is the white part of the tooth, and below the enamel you have dentine, it is yellowish, but inside there you have the pulp. Now the pulp has blood vessels and nerves, and it's the one that brings nutrition to the tooth and also takes any information to the brain. Now what happens is that the decay will start on the top part, on the enamel, break through, go into the dentine, and then go into the pulp. Now when it reaches the pulp will be inflamed or will now be in trouble. If you do not intervene, you're going to have a situation where you'll have pus being formed out of that process of inflammation and death. Now, the body has a defense mechanism. When there is infection, in most cases a prolonged infection, not the acute infection, the body will make what we call a granulation tissue. That tissue will be under the root that is affected. That granulation tissue is like a sac, so it starts correcting that infection from its spreading, okay? Because you know that teeth are very close to the brain.
Yes.
So it is like a defense mechanism to try and keep that infection localized, you know? Now, what happens is that from that process, it usually makes a channel into the mouth. So you'll find people having a small swelling around the tooth that is affected, where it now drains that pus. It's called the sinus. So the pus will be drained from that sac out into the mouth. So you keep getting pus going into the mouth. In the event that this process, because this is immunity now at play, it is a defense mechanism. In the process that does not happen, you are now going to have infection spreading beyond that tooth. So when the pus spreads, when the infection spreads, it gets into other areas, what we call spaces, but it will now get outside the localized tooth that is affected, and that's why you now swell. Are we together?
Yes.
So the abscess could be localized, but could now spread to other tissues. So when somebody wakes up and the whole face and the eye cannot open, the person was unable to control that infection in that localized place of the tooth. It now gets out of control, and then you have what we call space infection. It's no longer now that dental infection. It goes into the space. So we have different spaces. It can go in that canine space if it's just the upper teeth. It can go in the submandibular space below the chin. It can go in other spaces. It can actually even continue and go to the spaces in the neck. Okay, so once it is an immunity issue, once the immunity, you're not able to control that infection in one place, it can spread out. And then that is very dangerous, because once it gets into those spaces, you do not want to risk that infection going into some of the drainage spaces behind the teeth, where the most vulnerable place is cavernous, what we call the cavernous sinus. Now that is something very close to the brain. So many people get cavernous sinus thrombosis, which eventually brings, once you get that, the chances of survival are very minimal. Okay. So that infection can just go all the way to the back of the teeth and can reach the brain. Once that happens, there are very few people that will survive that. And so we sometimes may not talk about some of these things,
Yes.
but of course it can get to that extent, and that's why we've had instances where people have died. So hey, somebody died of a toothache, you know. So things can actually become worse, and then you find that you are in big trouble. Yes.
Okay, thank you so much for that. It was a very big concern and question. Now we are looking at remove or not to remove. This is a juxtaposition. So which of the two is better?
Yes. So really looking at all these scenarios, of course the ideal thing would be don't remove any tooth. Try as much as possible to maintain the teeth that are there, because they work in harmony. If you look at the way the teeth are, and it's something that we know, each tooth, because we have two arches, the upper one and the lower,
Yes.
the maxilla and the mandible. Now the teeth are always in partnership. You have a lower tooth, that is, if it is a canine, it is similar to the upper canine, so they work together. A premolars, you have the lower premolar, almost they mirror each other. And if one has a depression, another one has a protuberance. So they work together. That's why the teeth are not flat, they are kind of rugged. And if you see, if they are in what we call maximum intercuspation, they have a way they like a zip, you know. They have a way they work together, they fall into each other, and that is something that helps them, of course, to do their function in terms of eating and things like that. So what happens is that when you remove one, the opposite one will begin to come out, trying to look for its friend. So in doing that, it's going to have issues, because the moment it gets out, when it comes out of its socket, the space that is exposed, the root part that is exposed, will be sensitive, is liable to decay and so many other things. But now you begin to cause teeth to move. They begin to migrate and move and get disorganized. Whether they bend forward or they bend backwards or they super erupt, or now all the disorganization will now create another problem. It becomes so difficult for you to clean them, because the moment they begin to form what we call undercuts, so it is bent, your brush is not going, you're not going to cause your brush to get into those pockets that you have now created. So you find that now you begin to have other challenges. It started with removing one tooth.
Yes.
One tooth has affected 3 teeth, because the one the opposite one is trying to come out. The other ones, they are trying to fill up the space which the neighbors.
Yes.
They're saying, oh, what has happened to our neighbor? They are now beginning to move together. So you find that 3 teeth are now affected. So removing has a lot of challenges. Where the tooth is removed, the bone starts to resorb, to disappear. Okay? Within just 6 months, it has already been lost, almost 3/4. Within a year, you have lost half of the height. So when you begin to lose that bone, you're creating weaknesses in the bone. You're creating areas where, in case of an accident, this will be an area of fracture altogether. So you begin to now create more challenges than you actually had not planned to, simply because there are many people who are not even careful at all.
Yeah.
They come, it's maybe a very simple matter. They say, I'm so I didn't sleep, you remove this tooth. They are the ones forcing and maybe the doctor is trying to tell you, no, maybe something can be done, maybe you can change this, maybe you can, and somebody says, no, me, I don't want, but you don't know that very step or that decision you're making is going to now create other challenges, one after another. Before you know it, of course, we usually say that the cheeks fall in, because the cheeks fall in. If you were 30 years, somebody thinks you are maybe 68 and things like that. So these are the things we want to avoid. So if you're in a resource constrained area, there's no dentist, you've gotten the only opportunity you have is this person who is visiting, and so maybe you will not manage root canal, and then you can remove. But if you have resources at your disposal, you have opportunities, you should not remove your tooth.
Okay. This is very, very important. So, before you even go for a break, what circumstances, besides the inaffordability of root canal, what other circumstances can force you, the dentists, now to extract the teeth?
Of course, like we mentioned, if the tooth, you've stayed home for a long time and you've been trying other remedies, and the tooth has reached a stage where you're having that granulation tissue that I talked about under the root, you're having pus, pus has now gone to these spaces I was talking about. It has gone beyond its locality, and now you are having a space infection. Definitely we've got to remove the cause of the problem, of this problem. So we extract. So we are not extracting, of course, because we want to, but we're extracting to prevent other problems, other challenges. We don't want this infection to go to the brain, for example, like I've been explaining. So when we see risk in that regard, then we remove. Of course, their teeth, we said, they have been breaking. They started cracking and breaking and fracturing, and what is remaining are roots, and so we say no, let's remove them so that we can now be able to leave you with the teeth you can manage, because this one is going to be difficult for you to clean the root. The toothbrush is not designed to clean the root, and of course sometimes when that root is there, then the gums around, they may not heal because they're confused. Should we cover this thing? Should we? So you find that you're always having an inflamed lesion or something around that fractured tooth. So sometimes we remove. And of course we don't also want, we assess the risk in most cases. Accidents, some bad accidents where the tooth, you have to remove them, depending on what kind of accident you've gotten. There are times when it is possible to reconstruct, there are times when it is possible to refix them, there are times when it is not. So it depends on quite a number of things that the dentist will have to make a judgment on what needs to be done, and then can remove the teeth. So yes, there are instances where we remove the teeth.
Okay. Thank you so much, Doctor. When you say that it is the dentist to decide what to do with the teeth, you reminded me of very many people who actually go to the dentist with their judgment. I want this tooth out. But we are going for a short commercial break. When we return, we shall continue with the discussion. Stick with us. Thank you so much, you who are still watching Church of Uganda Family TV. This is the Family Hour with me, Adrian Austin Mukalazi. This program runs Monday to Friday at 9 p.m. This family is intended to empower families, one episode at a time. That is why we have fully packed themes for the entire week to empower you as a family. So that is why you should call all the family members, friends, and relatives. Encourage them to watch this program, Family Hour, and very many other programs on Church of Uganda Family TV, which are enriched to empower you as a family, and the content you can trust. This is Tuesday edition where we discuss family health, and today we are really looking at whether we can remove our teeth or not. Of course, if you've already removed your teeth, it is okay. We are not condemning you, but there is also a solution to filling up other gaps, as Doctor will tell us. So, Doctor, I think we start from there as we continue, and in this session we are going to discuss more and respond more onto the questions that you sent in throughout the entire period, and you still have a chance to send in your question and it will be responded to. So you can use our official WhatsApp numbers, or you can use our Twitter handle at COU Family TV. Your question will reach here now and we shall respond to it. Doctor, we talk about you talked about reconstructing, but there is also refilling. I think that is what we call commonly called cementing, and then there is also now filling up the gaps. I've already removed my teeth or my tooth, and then I have to refill. How does this happen? The three: refilling, reconstructing, and then filling up the gaps.
Yeah. Okay. So when you come to the dentist and you have a cavity, what you said is a hole.
Yes.
Whatever the different areas they will refer it to in a different way. But what the dentist does, we assess the depth of this cavity. In most cases, in a preventive way, we remove what we call the infected part of the tooth. What is infected? What is soft? We remove it and we leave the harder part of the tooth. And then we have medicines that we put there. So some of these medicines we usually put and tell you, please go and come back. So this medicine is supposed to help dilute the toxins. Or I usually use an example that if they have tear gas to you and your eyes are you're crying, usually you see people with water trying to dilute the tear gas. So this medicine does more or less the same. So you've had the decay process, you're having some pain, and so we can decide to say, let's put this medicine. This medicine has some anti-inflammatory properties, and it may help in reducing this decay process, this disease. So what happens is that we usually tell you, come back after 2 weeks. But the common practice is that when the pain has disappeared, many people don't find a good reason to come back.
Of course.
But what happens after some time, the problem will definitely come back, because that is a temporary feeling. It is an intermediate feeling. It is supposed to treat the disease, and then once the tooth is fine, we can now put a permanent filling. Because most permanent fillings may not be medicated. They just replace the lost tissue. But this one that we usually put and tell you, come after 2 weeks, and all the years I've practiced, I've seen that many people struggle with keeping that deadline. When the pain disappears, they also disappear. But eventually, they end up, of course, getting a problem again. So the ideal thing would be report back, then they can remove that intermediate problem, feeling. It was a temporary feeling. Then they put for you a permanent feeling, which is going to last you for quite a long time. Now, there are teeth which have just started. The cavity has just started. It is in the enamel, in that top part of the tooth. There we can feel it straight away. We don't have to give you that recall date and tell you, no. We can feel it straight away. We do that when we have cavities that are a bit deeper. Okay? So cavities that are deeper, we are careful to just feel them at once. Now, so the dentist is making a lot of judgment as he's preparing, as he's looking at the tooth, as he's cleaning it. He's making judgment of what materials to use. So we have different materials. That's why somebody can call you on the phone and say, Msao, how much do you feel a tooth? So you've got to look at which tooth and what, how deep is it? Because it could be an abscessed tooth, it has passed under, and you're telling me, how much do you feel it? No, that's a different whole thing. Because now when it is infected up to the pulp, we said you've got to go in there, clean that pulp, what we call root canal. You clean it out, and then once it's dry and clean and fine, then you can seal it. Okay. Now that is about really feelings. If you've had an accident, what we were saying, reconstruction and whatever. You've had an accident, the people have been waylaid on the way and they're beaten. Now, the face, the jaws may be disorganized. So we have special wires that we use to fix them. Okay, so with the things we can put and we fix them and try to bring the teeth in a proper way, bring the jaw, even if the jaw was shaking, and so we can try to bring it up and try to reconstruct the way it was. And then you heal. Take some time to heal.
Like how much time?
Well, 4 to 6 weeks. Yeah.
Okay.
So the bone is usually healed with 6 months, 6 weeks. So it will heal, and then we're able to do the other aesthetics and the build up the teeth and so on. Now, when you have already lost teeth, we can give you artificial teeth. So the artificial teeth, we have temporary dentures. What people here normally use, we have temporary dentures which are supposed to be intermediate also dentures as you plan for permanent dentures. Permanent dentures, what we call the partial dentures, are supposed to have a metal framework, a metal which is not just metal like
these
metals that we have in our windows and what. It's a special metal. It's made of cobalt chromium. Now that metal is a bit light and maybe may not be rough on your gums like these other temporary dentures. Now most of these dentures are supposed to be used for a short time as we make for you that metal framework. But because of course many people do not afford, again the affordability comes in, you find that people live with these dentures. But these dentures usually, if you are not looked after very well, they have challenges. It may cause the mouth to smell, they may irritate the gum, they usually fracture, and then people get super glue and try to fix them, and that also causes problems. So that will be may not be a good one. Of course, there are other things that you can do to still fill up the space. There are those which are fixed, and the fixed ones, like what people may know very well, a bridge, where you prepare the neighbors and you use the neighbors as abutments, and then you make the another tooth that is missing joined with the ones you put on the abutment, so it becomes a bridge. So that is another way. It's a fixed one. It will remain in the mouth, but it has its own limitations. So now we are talking of implants. Implants is the newest thing now, that you can have a special screw drilled into your bone, and that screw which is called an implant, you now get an abutment which you can fix on, and on that abutment you make a crown. So that one is much better because you don't have to now injure the other teeth, if I can use that word.
Isn't it painful?
Well, it's not painful. We use anesthesia to...
No, I mean after having that screw forever in your mouth.
No, it's a special titanium screw. It's going to be well adapted with the body. It will be integrated with the body. It is something that because when we talk about some of these, of course, when I talk of a screw, you're thinking of now these screws we use in the timber. But this is a special, screw that many people walk around with, and there's no problem.
Okay.
Yeah.
Okay. Wow. Now there is a very interesting question here. It says, if I wash my teeth once, after how long should I wash my teeth again? And what are the side effects of cleaning my teeth?
Well, that's a good one. One, we are supposed to visit the dentist every 6 months to clean your teeth. Okay?
It shouldn't be a one-time thing.
No, it's not a one-time thing.
Okay.
You're supposed to. The way you service your car, you cannot, when you buy a car, you cannot service it once and then you say, now I'm done, You've got to keep changing the oil. So you're using that mouth. And because you're using it, you're eating, these things that we have been talking about are likely to form, are likely to be there. So you've got to go and have that. We call it a professional cleaning. It is much more than what you do at home. We have more tools that we use to be able to remove what we call supragingival and subgingival calculus, the things that are around the gum, that are already visible and those that are not visible. So we're able to clean them. And those are the causative agents. They're the ones which are going to harbor that bacteria that gives you trouble. So we are removing them in advance. Now, once that is done, if you're using proper things, they definitely shouldn't have side effects.
Okay.
Side effects will be people who, if you definitely go to maybe a clinic that is not well stocked and they're just going to use some rough things to clean your teeth, yes, they may remove some enamel, but that shouldn't be a big problem than if you don't clean. So if you look at the benefit, but there are clinics where you have very nice prophy paste and things that are soft on your teeth that will clean your teeth and you not have some of these side effects. So it's important to be able to clean. I usually tell my patients that if keeping 6 months is a problem, tag cleaning your teeth to a big event. You can say before Christmas, every Christmas, I will also make sure that I work on my teeth. Or you can say every Easter, at least, so that once a year at least you visit the dentist. Because the benefit is that beyond cleaning your teeth, the dentist is able to observe what other changes, what other teeth that are developing, new problems. Is there anything that is coming up? Because we do a thorough exam. Yes. Do you have any lymph nodes that are getting enlarged? What could be the problem? So visiting a dentist, really, that having that check up is as important as men who drive cars servicing that car. Okay, so you get a lot more benefit than the one who is not.
Okay.
Yes.
Now, the other one is about braces. What are the effects, the side effects of braces, and for how long can I wear them?
Yeah, so braces are given
and maybe
to...
if we can start from who is supposed to have braces.
Yes. Okay, so the you see people coming and say, oh, I want braces. Also, people can call. These days they call, say, how much are braces? And so, but it's a treatment modality for malign teeth. So if you're having teeth that are not in line, maybe, and I said earlier that these are some of the challenges that young people get.
Yes.
When they remove the baby teeth early, that sometimes the space for the teeth that come later, because it's a kid is 4 years, 5 years, you've removed some teeth that are supposed to get out at 9 years. So what will happen is that the teeth that come first in the mouth may assume a position that is not theirs. Now they decrease on the space, what we usually call the leeway space, for the canine and the premolars. By the time these teeth come at the age of 10 and 11, they do not have where to. The space has been occupied. And so most of the time, that is a big cause of malign teeth. So we find the canines which come later are on top of the other teeth. They don't have space. And but that's not it. You have situations where, for one reason or another, the upper jaw is bigger than the lower jaw. The lower jaw is bigger than the upper jaw. So there are also problems that come that after assessment, a proper assessment, we usually call it mode analysis, and we have other X-rays that we take called SEF, and we do a SEF analysis. After some of this analysis, we're able to tell what is what, okay? Because you could be saying maybe it's the jaw, which is the upper jaw, which is big, but maybe it is the lower one that is big. So once you do those studies, you're able to know what to do. Then you can be able to decide, because braces is one treatment, but there are other things that can be done.
Okay.
There are other appliances that can be given to a patient, and even before the age of 12, we usually do the fixed braces at 12. But even before then, there are things that can be made, and these appliances will either prevent or actually assist the patient in order to have good occlusion. So that's really to say they have side effects. Usually it depends on the case. We put them on for maybe talking of a year, 2 years, depending on the case.
Okay.
Now, when you talk about side effects, yes, they can have side effects if you, because they use forces. If the forces are too much, you can have erosion. They can get eroded. They can lose part of the material of the tooth. Put too much pressure on them, and so the person doing this should be knowledgeable, should know how they are balancing these forces. They should be able to tell what they are doing. They should know what they are doing. Otherwise, you can have challenges. And then the others, of course, many people think that, oh, the teeth are too many, they are not able to fit, so they remove. In that removing, if it is not indicated, you'll end up with a worse situation. Yes. So there are all sorts of challenges that can come out of that. So you've
Can
got
someone
to make
effectively brush when they have braces in the mouth?
Yeah, of course, it's a challenge. Because now you have additional things that are a limitation. So we show you how to brush, but sometimes we recommend like an electric brush so that it is able to help you brush. But sometimes we keep cleaning in between as you come for, because when you have braces, you keep visiting a dentist each month for adjustment. So sometimes we do cleaning in during those appointments.
Okay.
Yeah.
Well, another one is I brush my teeth and my tongue, but my mouth still smells. Why is this like this?
Yeah, so we said bad breath, what we call halitosis, is not only, so it can be caused by tooth decay. So if you have cavities that are not filled, there can be a retention for decay, and that decay can smell. And also the gums that are sick. So if the gums are not treated, they can smell. Especially acute necrotizing gingivitis is one of the conditions that will cause, those gums will be smelly. Now, of course, they brush the tongue, but the bacteria resides at the posterior part of the tongue, and you may brush this tip here, because when you try to brush behind, it can cause gagging. You feel like vomiting. So sometimes somebody may have that gagging, so they never clean really the tongue very well. But to leave that on, we said there are other challenges. People who have dyspeptic syndrome, tendencies, they always bring back food, the gases from the stomach. That can also be a cause of bad breath. They always bring back some gases from the mouth, from the stomach. So that can also be a challenge. And of course, also some people, it is an issue of what foods they're eating. Yeah, if you're eating garlic, definitely it stays in your blood. As long as it's in your bloodstream, people can tell. It can be bad breath, and so other foods and other spices. And so it's at the end of the day, we definitely, the dentist is able to remove out of the list of 10, keep removing certain things until they can find out what is the problem.
Okay.
Yeah.
For how long should a single brushing exercise last?
That's a good one. Really, what the focus shouldn't be on time. The focus should be on, are your teeth clean? When you are clean and you put your tongue on your teeth, do you feel they are smooth? That should be the focus, not the time. Because of course somebody can say, I am taking so long, but they are still doing nothing. Another one can be so fast, and So the whole point is, yes, try to brush the upper teeth from one side to another, and brush outside and go inside, do the same. Go down, brush one quadrant, you come to another, you go inside, you also go outside, and you come also in front. You brush your tongue, then you said you rinse, spit. Then you have not put toothpaste. That is removing food. The first time you're removing food. The second time, you now do the same with toothpaste. Don't rinse. Don't just spit that big foam, but do not rinse. Now, once you do that, really maybe 2-3 minutes, it should be good time for you to effectively clean your teeth. Yes.
Okay. I think most concerns here are rotating around, swelling, cementing, and then brushing, which we have really emphasized. Now, as we draw closer to the discussion of this, Doctor, what would be your parting shots to someone who has watched us, or who has watched us only today, or someone who watched us from where we started this discussion of oral health to date?
I want to thank every person who has been dedicated to watching this show, but also to say that it is important to pick a few things. That even if we forget my name, it is important to know that you can prevent tooth decay by brushing 2 times a day. And even if you forget to brush in the morning, do not go to bed without brushing. If you brush your teeth at night, you're most likely to keep them. If you don't brush at night, the bacteria at night have a long time to cause destruction of your teeth. By morning, they have already produced enough acid that will be a problem to you. So don't go to bed without brushing your teeth. If one is able to do this, and in addition, have time to visit the dentist in order to have a checkup, to see if everything is in order, because most dental diseases may be painless not until it's too late. By the time you develop pain, maybe your gums are already damaged or already disintegrating. So it is important that at some point you visit a dentist in order to have that check that you need. Otherwise, I want to wish you Jesus that if you can keep your teeth and you still go to hell, and it is important that you go to heaven with no teeth than to go to hell with all your teeth. Thank you so much.
And someone is already asking for consultation in case they want to consult you. Where can they find you?
So yes, Run Dental Clinic, Akamwesi Shopping Mall, Chebando, 2nd floor. And my telephone number is 772-642592. We also have another clinic at London Chambers, Run Dental Clinic, London Chambers, 2nd floor.
Thank you so much, Doctor. It's a pleasure, and we are really grateful as Church of Uganda Family TV and as the entire team of Family Hour. We are grateful. Thank you so much for giving in this time to educate us and also give us all this information concerning oral health. Now, to you, our viewer, it's always a pleasure having you watching Church of Uganda Family TV. Family Hour, empowering families, one episode at a time. Now, after this show, we shall have Soul Moment, which you do not have to miss. But also, endeavor to watch that movie, just in case you have not yet, it's not yet time to sleep. Yeah, watch this movie. It will enrich your life. But also, we have Good Morning Family in the morning tomorrow from 7 to 10 a.m. Family Hour will continue tomorrow. We shall be discussing family, finances, and wealth. Edwin Austin Mkalas is my name. I've worked with Brinko Ategeka, Atwoki, and Didmas in transmission, but also Jonah Jal, the producer. God bless you. We meet again tomorrow.